Today we're speaking with Dr. Anthony Lopresti, one of the physicians here at MDi Wellness Center. Welcome, Dr. Lopresti.
Well, thank you. Thank you for having me today.
Great. So can you tell us what services you provide here at the center?
Well, I specialize particularly in diabetes, particularly type 2. I also provide services in allergy and asthma medicine and try to prevent the aftermath of those conditions. And also I do some osteopathic therapy for musculoskeletal problems. As of late, starting today actually, I'm going to be doing some IV vitamin therapy for cancer patients and patients that have adrenal fatigue.
Okay, we'll touch briefly, if you will, on each of those treatments that you mentioned. And let's start out with diabetes. Diabetes, I did some research, 26 million children and adults suffering from diabetes in the United States, about 10% of the population. 79 million have pre-diabetes, which you'll explain to us hopefully after this, and with 1.9 million being diagnosed with diabetes each year.
And that's growing, unfortunately. And the age of onset is getting younger.
Okay.
So,
and why is that? Why do you think?
Well, I think it's the increase in processed foods, the obesity problem, lack of exercise. Patients are not taking care of their bodies, and they're finding more and more, even in traditional medicine and allopathic circles, that we are what we eat, and it is important the kind of foods that we put into our body,
right,
and the amounts as well. So I'm finding that I like to, in the younger population especially, focus on the pre-diabetes, which is to prevent the full-blown, which does all the harm to their pancreas, and kind of like it's a little bit too late for them to get the major effects that we want to see in the pre-diabetics. When their fasting sugar gets above 100, we put them in a pre-diabetic range, and we try to work with them with behavioral modification, and also biofeedback techniques, supplements. One in particular I like to use is cacao, which is how they make chocolate, but this is without the sugar. And it's good to control their appetites as well as lower blood sugar. It's good for brain health. It does have caffeine in it, so they have to be aware of taking it earlier on in the day. But there's other things like cinnamon, chromium, and sometimes medication is necessary. There's new medications out right now that focus on the pancreas, on the gut, as well as the liver to help reduce the amount of sugar in the body.
Okay, so yeah, with diabetes, it's a terrible disease, and it can actually lead to amputations.
Exactly, amputations, loss of vision, cardiac problems. It's probably one of the number one or number two reasons for cardiac problems after hypertension. If you go to a major center where they're treating diabetes, sometimes I've had the good fortune of going to the different clinics that specialize in diabetes. Joslin is one that I prefer, the Joslin Clinic for diabetes and endocrinology. Very helpful in giving me tips on more of a holistic approach. And the benefit of working here at this clinic at MDi is the fact that we do have the resources for holistic medicine. We have naturopaths here, we have chiropractors, we have patients that do Ayurvedic medicine, we have different classes that can help patients with their exercise program. So I think that and also psychologists, because it is a mind-body relationship that has to be addressed with diabetes, as well as any illness. Because as in diabetes and all illnesses, we're finding more and more that it stems from inflammation, and inflammation can occur from stress, and it also can come from just not eating right, putting the wrong foods into your body, as well as not taking care of your body from an emotional, physical, and mental aspect. So that's one of the key reasons why I like working here, because I like to incorporate all those modalities that we have and we offer, and it brings the best results.